Hi, welcome to the Chandler Dual Diagnosis Home. My name's Laura Lee, and I'm the Resident Programs Supervisor. Come on in. I'm excited to show you more of what we have to offer. For years, the standard model was to treat addictions and mental health separately. We will be treating the whole person through integrated care in order to address both their mental health and addictions at the same time. Residents will be participating in a minimum of 5 hours of treatment, including group therapy, skills group, individual therapy, individual skills training, and case management. They will also be attending daily recovery meetings with the option to attend virtually or in person in the community. Let's go on a tour. And next, I would like to introduce Dr. Jones.
Hi, I'm Dr. Jones, and I have the honor of leading the overall medical treatment at Southwestern. I'm particularly pleased to introduce this program as it's the first in our tri-state area to address the complicated recovery needs of individuals with both addictions and chronic mental illnesses like schizophrenia or bipolar disorder. This program will serve as a stable base of support for those individuals with those kind of problems to have multiple treatment modalities applied to improve the situation for them. So I'd like Dr. Mackey to talk a little bit more about the addiction part of the program. Dr. Mackey?
So by its design, this program is going to require highly individualized treatment. Traditionally, stable addiction recovery is on a foundation of a social networking program for the individual, which requires a lot of peer bonding, a lot of deep trust, and these are features that do not come easily to anybody with an addiction, but particularly when there's an overlying mental health disorder. The program will require us to identify the obstacles needed to help the individual overcome. For instance, the person dealing with post-traumatic stress disorder will have different obstacles potentially than someone who has unstable mood like bipolar disorder, which would also be different than a person who might have a strong paranoid thought disorder. So we'll use everything on our menu to try to help them, including optimizing their medication treatment. Commonly, people who are with mental health disorders, when they get sober, their medication needs change drastically. We'll try to find medicines that are optimal for their medical, psychiatric care, that they can be compliant with and minimize their side effects. Try to identify those things that keep them from going to meetings, incorporating in the recovery community, and it will have to be highly individualized. The length of the program will be highly individualized. We want everyone to hopefully commit to 90 days at a minimum, but it can be extended many more months than that, up to a year. But our ultimate goal is to have these difficult situations become as productive as they can in the community, be independent in their living, and just give them the best chance to be productive in our community.
All right, thank you, Dr. Mackey. I'd now like to introduce Sarah Barnes, our highly competent registered nurse, and Jess Thomas to explain a little bit more about the nursing role here at the Chandler Home.
So here at the Chandler Home, we'll have extensive nursing services provided to the residents. The nurses will assist with medication management. They will help with linking them to their primary care physician, work on, referring them out to specialty appointments and whatnot, and just make sure that those physical health needs are being taken care of as well as the substance abuse and the mental health issues.
I'd like to emphasize that the location of this program downtown is very convenient to physical health providers, mental health specialty treatments, and peer support services like the Peace Zone. If any person or family member or provider is interested in accessing this service, they can just call the Stepping Stone line or the Lavelle Center, where our intake specialists will be happy to help them.
Thanks for joining us today, and remember, if you would like more information, you can contact me at the Lavelle Center, or you can have your client call Stepping Stone directly for an intake. Bye!